Leadership has worked in the NHS for a number of years in a very specific way. It's been quite autocratic, quite a triangulated system where there's been one individual leading quite a huge organisation. It's all come down to that one person setting the line of travel and the direction, which has been quite an oppressive field to be in for people who want to come up and be leaders themselves within that organisation. The change has come about basically by starting to really focus on the relationships, the human contact between these professionals, and starting to realise that actually we're all in the same boat, we are all experiencing the same challenges, the same tiredness, and actually by working together we're actually starting to create some headspace. And that's really enlightening. We've been doing some things around generative listening, trying to understand how we talk to one another and really listen, and that's really brought people together on a very humanistic relationship perspective. So the relationships between primary and secondary care have been fairly difficult. Two massively different organisations. Again, we've gone back to the human level and started to connect with those individuals from secondary care with primary care who want to make a difference. And basically we've been starting to make those changes, those transformational changes at grassroots level. So in West Lancashire, around the GPs, what we've tried to do is a GP federation. We've come together and agreed localities. So we have 3 localities and we meet on a monthly basis in each locality and together to start to actually talk about some real common themes, you know, what really matters to the GPs, and that brings them together with a common purpose. Then they're able to talk on a real personal level and actually connect with one another, and that starts to break the barriers down, and we've been doing that on a monthly basis, and we've been doing some real good learning techniques with them to actually understand one another. Rather than it being business, it's about personal. Usually the route through to secondary care or primary care has been through the managers or, you know, sort of the traditional leaders. What we're doing now is we don't need permission from everybody to do everything. We're actually going out there and having the confidence to say we want to make a difference. This is absolutely what the patient needs. Let's just go and do it. Building relationships and trust might sound really simple, but actually it's quite complex. All these guys know each other. They've worked together on the patch for years, but actually they don't really know each other. They get together once a month. So what we've tried to do is try to look at one area, let's not overload them, one area that really means something to them, that actually allows them to come out and share quite vulnerable bits of information, but actually create what I do and what the Federation guys do is support that environment to say it's a safe area. One particular GP, single-handed, really struggles because he is single-handed, he doesn't have partners to talk to, and was actually really struggling. What we managed to do is by gaining the trust between ourselves and on a relationship point of view, and trust, and him actually over probably a 12 to 18 month period realising we're there to help, has actually come out and asked for help. I always say that it's all about we, not me. So it's taking the person out of it, it's being agnostic to what your own needs are and actually starting to really understand what people are saying to you, maybe reading between the lines. So it's very much around taking yourself out of it. It's not about you, it's about everybody. And then you've also basically got to create the platform, create the environment for those people who are perhaps not so shouty, perhaps not in the limelight, but have some amazingly glimpses of brilliant that can be brought to the platform and give them that arena to actually shine, and then you start to grow your leadership teams, so it's not just down to one person, you get continuity. So one individual patient who was really suffering from depression has now got a suite of interventions through the Council for Voluntary Services, which looks at how they can make themselves resilient and be strong in their own approach rather than relying on medications or psychological interventions, and that's been really powerful, and they've changed their life so much they've actually gone back into work now. Change can be made at grassroots level and really make a difference, and I suppose you're leading by example, and then you start to gain the trust of those people and start to talk like we're talking now about being human, about trusting in relationships. It's the relationships that are going to get us to where we need to be, not just the one person who has an MBA or whatever.